beautiful people. Welcome back to Through the Rabbit Hole. So I think what I'm going to do is I'm going to start it off with, if it's okay with you, Ryan, if you could maybe tell us that story you told me earlier. It's just because I want to show how little the NHS care for the elderly.
Absolutely. I have another friend who happens to live in Scotland, and her mother went to hospital because they honestly didn't know what was wrong with her. And, she is 73 years old. She had messaged me telling me that I could tell the story. So her mother is 73. They overdosed her on morphine and then gave her Narcan to reverse it. So she's now confused and doesn't know who we are. Just now, they say it'll take another few days before it gets out of her system. They only realized that they gave her way too much when I told them that she doesn't know who I am or is aware that I am sitting in front of her. Again, overdosed her. Then she sent me a picture of her poor mother sitting in the chair, basically unconscious. So she said, this is how I found her, and her resting heart rate was 170. They had muted her warning alarm for her heart so that nobody could hear it going off nearly through the whole hospital, and I left them without a name. So then she had said, unfortunately, over here, the protect themselves first. They will always have this wrote up in the notes as didn't respond well to pain relief or administration of the Narcan to reverse the effects. It will also have the consultant and doctor's signatures beside it. There are no notes on what it has the morphine from the syringe driver put into her with the tap left open. This should be opened once an hour by the nurse to give the dosage. However, someone forgot to close it. And I only found out by chance of walking and taking the trainee nurse that I had to check on the notes, and it wasn't there. There's no way of ever winning against the NHS over here. Also, that there is a very probable chance that her mother may not make it out of there.
Yep. And that is actually a real thing that's happening here. And it's actually really scary because people are terrified to be sick or to get sick because they're terrified to go into a hospital here because they might not make it out alive. And it's worse for the elderly. I mean, if I had £1 for every time I have seen a monitor being switched off, if I've seen a bell being removed from an elderly so they can't ask for help, because they say, for example, you have somebody who has dementia who is, ringing that buzzer constantly, maybe a little bit more than they should. They will go in there and they will remove that from them so they cannot use it. And I think it's absolutely disgusting that this is the world that we're living in today. Anybody else got anything to say on it?
I know that my mum used to work with the elderly, and she said that she hated working in the care homes because they were so awful to the people in there, and she'd report them, and then obviously she'd get bullied out of the job.
Yeah.
She ended up working just in the day centres, but she loved the job. She loved taking care of the elderly, and she always said to me, when I get old, do not put me in a care home. Don't put me in one.
It's funny, there's a lot of carers, people who have done the job, who will say the exact same thing. And it's because if you do see something and you do go in and complain or raise concerns, it's easier to get rid of you than have these care commissions and all these people come in and do an investigation, because that means if they come in and investigate, they might find other things. So the easiest solution, is get rid of the problem, and i.e. the person who's telling the truth. Yes, Babs.
So I would say that the one thing I would disagree with about winning against the NHS is that, again, I just remember when I worked in a private client law firm, there was a news story in the paper that a person went in who was 14. It was like gallstones or gallbladder, something that required an epidural. And the dickheads left the epidural in, and she went in a fit, athletic, on sports teams in her school child, and came out in a wheelchair. Now I know, because a lot of solicitors, especially those who did personal injury law, were really tracking that story in the law journals and the law gazettes and the law times, because they knew that that would be an extremely large payout for that child, not just for the life that was stolen from her as a able-bodied athlete, but the things that she would never be able to do as a girl going into womanhood. But and I would say this for the elderly and the disabled, we do often get overlooked, and it is a thing of, you're kind of just brushed off as you're just trying to cause trouble, or you're just trying to cause issues, or you've not got a legitimate complaint. However, I would say also that the treatment varies from NHS trust to NHS trust, because when I had a significant cancer scare, I went into an NHS hospital. I had to wait around for the surgery because they had to clear out the gas, because there is a possibility I'm allergic to anaesthetic gas. So they had to make sure that was all free of gas so that they could properly anaesthetise me. But the food was great. The nurses and the doctors were amazing. The surgeons were top notch. I was seen, I had my first scan and I was seen within a month. I'd been seen by the hospital within a month, and my surgery had been, scheduled and all of that. But on the flip side, a generalist hospital, and this is an experience I had, was I went into the A&E with suspected appendicitis, got put up to the ward. They realised it wasn't appendicitis, but I had a serious infection inside of me, which meant I was nil by mouth for 3 days while they pumped me full of IV antibiotics. Day 4, the doctor was like, yeah, no, we can start feeding you now. It's fine. And they put my breakfast right in front of me, and the nurse, who hadn't bothered to check in with the doctor or change anything, walked straight up to me and ripped the food out of my hand and said, you can't have this. By the time I got the food back, it was at least 30 minutes later. I was upset. I was in tears. It was not a good experience. I mean, yes, I came out healthy, but, this would be the same hospital, this would be the same ward that I literally got terrified for my own life, because my IV antibiotic bag had gone right through and it had started pulling my blood out of my veins. And obviously, as everyone knows, if an IV bag turns around and then starts pushing it all back in, that could have led to me having air bubbles in my blood. That could have killed me. And it wasn't until my mum, who was an ex-nurse, walked over to the IV bag and started taking it out of my arm that a nurse finally came over and almost pushed my mother aside so she could look like she was doing her job. So the difference between specialists and general hospitals is, it's night and day, really.
Mm-hmm. That's crazy. How do you fear for your own life inside of a hospital? Like, it just shouldn't be that way, really. Yes, Ryan.
Well, I was going to add to the story with my late mother-in-law. We had, she had gotten to the point where she had started falling, and she fell in the bathroom in the suite. And she basically karate chopped the toilet and gave herself a humongous hematoma on her forearm. Well, we took her to the hospital so that she could get checked out, make sure she didn't bump her head. I insisted on x-rays. They weren't going to give them to her because they didn't feel like a knot on her head. And I had to insist that they check her and make sure she didn't hit her head or have a concussion. So we ended up keeping her in the hospital because I was ranting and raving to run these tests on her for about a week. The very first night, she calls me 9:30 at night. Ryan, they won't take me to pee. I've got to go to the bathroom so bad. I've been ringing and ringing. I had to get on my husband's phone while I had her on my phone and call that hospital to talk to that desk to go take my mother-in-law to the bathroom. She is crying that she needs to go to the bathroom. And they kept saying, well, every time we go in and ask her, she says she doesn't have to go. I said, she has dementia. It's in her records. Just take her to the bathroom because she is crying at me that she needs to go. And I had to scream and cuss and threaten to get the patient's advocate on the phone before they went into that room and took her to the bathroom. After that, I spent every day up there and slept up there just to make sure she was getting the care she deserved.
Yeah. This whole bathroom thing, this is another thing that gets on my nerves. As an ex-cater, that was another thing that used to be pretty bad. Not everybody, but some girls were just plain lazy and would hide and wouldn't do their routine checks, or even if they did, they'd lie about it. Like, it wasn't like you didn't know that they were lying, because then an hour later certain incidents would happen and it was very obvious that they weren't taken to the bathroom. But again, lack of staff, lack of training, these girls seem to get away with it. I'm going to tell you something really, really quick. I think as a caterer, this is probably the worst story, one of the worst stories I have ever experienced in my life. I was working at a care home and we were expecting an emergency coming in from the hospital. We didn't know much, just that he was coming in, end of life care kind of thing. He was just, we were to keep him comfortable, and like that wasn't unusual, so that was fine. And when he first came in, I knew there was something off, and there just wasn't, something was just not quite right, just because of how he sounded. And then after the paramedics left, we went in to have a look and speak to him, and we couldn't, because like he was really struggling to breathe, like they were giving him nothing to help him. And I kept hearing like this really weird gargling sound coming from his chest. It just kept coming, and you could hear it in his throat. And we got the nurse in, well, the senior in, sorry, because we didn't have a nurse at the time, to have a look and find out what was going on. And we got his notes out, and it turns out the man, he was drowning on his own lung fluid. They wouldn't do anything. They never left him. Even when we phoned, they wouldn't come back and get him to help in any which way. I think he had a DNR in place. So because of that reason, myself and another friend spent, I think it was a day and a half, like taking turns and holding this man's hand, waiting for him to pass away while he drowned on his own lung fluid. And when I tell you, that's haunted me for the rest of my life. That really, really has. I've got another NHS story about being pregnant. My cousin, she was, when she was pregnant with her first child, or she went fine through her pregnancy, everything was fine. She got to the labour, and that was when she started having the problems. So she had to go in for a C-section. It's like, long story short. And on this operating table, everything that could go wrong did go wrong. And at one point, the surgeon had looked at her other half and says to her, "You've got a choice, either your other half or your child." It was that kind of situation. And so this guy, he was really trying hard, because he was trying to save them both at the end of the day. But it was like, everything was just like, she was bleeding out, it just wasn't working. And the guy says to her, "I need to knock you out." He says, "I need to put you to sleep. I'm going to try and save you both, but I need to knock you out, and I need your permission to let me knock you out." he says, I'm going to have to do something really unconventional to knock you out as quickly as possible. And he says, do I have your permission? And she said yes. And she said to me, when I tell you I got the shock of my life, this man wrapped his hands around my throat and choked me out. Like, just out cold. But whatever happened afterwards, she came through, and her and the baby were like still here, you know. And I mean, that's got to be the craziest birth story I personally have ever heard. I mean, I've never heard of a doctor doing anything like that before.
No.
And not since. It's a little crazy.
Can't say I've heard of it either.
I've never heard of a doctor doing that before. She said that to me. I wasn't there, but like, for her, I just don't think she would, you know, say something like that and for it not to be true, considering how traumatized she was after she left the hospital.
Yeah.
Which it is very bizarre that he did that. Like I said, I've never heard of that practice before, but she said that definitely happened to her. Yes, Trace.
You know, but that's the thing too, is we do rely on sometimes unconventional methods in order to get our lives saved. And I'm sure that there are great doctors that's their, they go through a lot every single day. And I know that there are sometimes far and few and in between, and they do have these unconventional methods that they know that will save the patient. And the amount of trust that she had for him to do that was, first off, unbelievable and amazing. And we discount those stories because he wanted to save her life. And then we have, on the opposite end, the amount of horror stories where some doctors don't want to save lives. It's like a hit or miss.
It is, and that's why I wanted to tell that story, because it's unfortunate doctors like that are far and in between, and there's not many out there. I mean, she swears he saved her life that day. And in that moment, she says the only thought she had was her baby. And when he says, you know, can I do it? She was like, yes, save my baby, you know, and I think that was her driving force. Yes, Babs.
That for me is really scary. And whilst I would not condone every doctor going, well, we're just going to knock you out quicker and, you know, strangle the patients, you know. You do have the few and far between doctors that do want to save lives. But then you have the other doctors who bring their own biases into play. And they don't want to do what's right for the patient. And they just want to do what they think is morally and ethically right. And, you know, that is a sad state of affairs, that we allow the wrong uns to actually still have jobs. And this is where I think there's that element of we need to really be accountable for the blaseness we've had with the wrong uns. Like, how many times has everyone on this panel sat there and gone, this is just the way women get treated in the healthcare profession, and then refuse to do things like put in a complaint or report them to the medical board or things like that. I know I am definitely guilty of that numerous times, to the point where I literally had a doctor, a male doctor, try and tell me that I should not be allowed to be on the contraceptive pill because it's only for people who have sex. Not that it's a quality of life thing, not that it's due to the fact that when I was 15 and a half, I threatened to kill myself unless they put me on the pill, well before I was sexually active. But in his opinion, unless you were sexually active, unless you had a boyfriend, a husband, or a partner that you were regularly having sex with, you should not be on the pill. So I let shit like that go for years. And apologies for the swearing, but it just got to the point, and I think the line I crossed for that was the day my dad's GP decided to take him off his antidepressants that he'd been on for 25 years, cold turkey, when he had other mental health issues and severe dementia. But no, he wanted to, take him off his antidepressants cold turkey. I think that for me was the turning point when I was like, no, that's wrong. We need to start standing up to these people, because that is absolutely diabolical that any medical profession would do that.
Contraception is for more sometimes than just sex. I just wanted to say that. Yes, Trace.
Bubs, I can completely understand, because once I had my twins, I had to go. My gynecologist had retired, and they had put me on with a different gynecologist, and she never ran one test at all, never did anything. And I was going about my day to day, taking care of my babies, no big deal. And then all of a sudden, probably 3 months in, I was so tired. I mean, it was a different kind of tired. It wasn't a tired of, oh, I've gotten so much done, I have babies. It was I can't even keep my eyes open, exhaustion. I need a nap. And that nap would turn into these long bouts. And everyone kept discounting it and saying it's postpartum. And come to find out, my iron levels, I had no iron whatsoever. And nobody was monitoring my iron at all after the pregnancy. So we just kind of run the gamut on whether or not we can trust someone, because prior to being pregnant, I had the best care ever. After pregnancy, I ran the luck of the draw and got the worst care ever.
It's so sad that can happen. That it depends what doctor you get. It depends what hospital you go into. Not everybody's going to get the same level of care. Not everybody's going to be treated the same way. And there's actually some people out there who fear for their own lives when they walk into these places. And, you're meant to be able to trust these doctors. Sorry, Trace. On you go.
No, and to keep blaming it on postpartum as if that's a standard thing that every woman gets. It's always postpartum.
And it's the guessing. It's the guessing for me. You're guessing. You're looking at a woman who's just had a kid and just been like, she's exhausted, she's probably a bit postpartum, she's probably over exaggerating, without actually even, why don't we take some bloods and see what's actually going on? Do you know what I mean? Yes, Babs.
That I just kind of, firstly, Trace, can I just say I am so sorry you went through that, but it's what we all, and sorry, this is not me minimalizing, just saying, we all have to go through that gambit, and this is why. And I sure as heck know that I made Carla laugh when I got the dodgy doctor who tried to gaslight me recently, because the poor doctor I had next, she was lovely. She is like all the rage. Like, everyone loves this doctor. She is wonderful. But because I'd been gaslit the day before, I literally walked into that appointment with a stack full of papers, and I went in there and I was like, right, you're clearly not the doctor who tried to gaslight me yesterday. So Here's my email to the Integrated Care Board. Here's their response telling me that what the doctor yesterday said was absolutely a lie. Here's the thing around breast reduction surgery on the NHS for health reasons. Here are the criteria. Here's how I meet them. Here is the option for weight management because, you know, I meet all the criteria except for my weight. Here's the stuff around appealing decisions based on exemptions because I meet all the other criteria. Here's the part where you fill in the form to do that. Here is everything you need to do your job. And it's that thing of, I've gone through that gambit so much now that even if it's a chest infection, I will not call the GP till I can answer every single question that they could potentially throw at me. For instance, what is your peak flow? My peak flow is this. It's usually that. This is my blood pressure. This is, I am coughing up stuff. It's looking like this. This is what my chest sounds like. This is this. This is this. So they actually listen to me, that they have no choice but to do their job. And we shouldn't have to do that. We are not the medically qualified ones. We should not be the ones having to go to them with all the information. They should be the ones providing it. And so the standard of care across the arena, it seems globally, is just falling well short for anyone who is a girl or a woman.
Like, you shouldn't have to walk into a doctor's office with a list as long as your arm just to combat the gaslighting that you're about to receive. That's just, like,
Exactly.
why would you have, that's insane to me. Yes, Trace.
And the only thing I would say is to every woman listening, mother, woman, doesn't matter who you are. If you have questions and you are not getting your questions answered, you keep going to someone until someone answers your questions, because knowing that you are being gaslit, knowing that someone is on that other end and they can possibly help you and that they're not, you keep pushing forward until you find someone that will help you, no matter how many people you see. And even if it's just to give yourself some sort of acknowledgement, make sure that you go talk to someone, because eventually someone will be placed in front of you that will answer those questions for you.
Mm-hmm. Exactly, Trace. That's so true. I find anytime you're dealing with a medical professional, anytime I have dealt with a medical professional, I have had to literally lose my mind and start, like, just basically telling them straight, to be actually listened to. And if that's exactly how, you know, women out there are feeling with these NHS workers or your doctors and stuff, start demanding what you need and how you feel, and don't be taking no for an answer, because at this point we have to fight for ourselves. Mm-hmm. Yes, wifey.
I was just actually wanting to pick up on what Trace was talking about with the postnatal depression. Mm-hmm. Actually, it happened with my mum as well. My mum had 5 normal births, delivered most of us in the house. My granny delivered us until she hit 38. She thought she was going through menopause. She goes to the doctor, and the nurse turns around and says to us, "Oh, I'm going to do a wee pregnancy test here with you." She's like, "Don't be ridiculous, but okay." So it turns out she's pregnant. She had a lot of complications, high blood pressure and stuff like that. So they had booked her in for a cesarean section. First time she's ever had it done. Like I say, she had normal deliveries and stuff like that. But after the fact, my wee brother was born, and he was premature. He was only like 4 pounds something, can't remember exactly what it was. And he was in the hospital for a while, and we got him home and stuff, but my mum did not connect with him the way that she connected with all other 5 of her kids. My little sister picked up a lot of the slack because she lived with my mum. And you could see it. You could see it in her. Nobody wanted to help her. She was going to doctors and stuff. Yeah, she ended up in a paranoid mess with everything. And it's just heartbreaking because she didn't get to spend the time with Tyler that she could have, you know, because my mum passed when he was only 5. So, like, she obviously didn't have that connection with him at first. And by the time she did, you know, yeah, it was too late, you know, because, and now he sees my wee sister as a mum. He has from an early age, because obviously when my mum passed, she brought him up, you know. But yeah, I was just wanting to pick up on that. Not everybody always picks up on them having it either, you know.
Yeah, and that's the thing. They don't always pick up on these things, and they really should be, especially in women who are having babies. It's so dangerous to be a woman and to be pregnant. So dangerous. And I don't think that is highlighted enough. And I do not think there is enough aftercare for women after they've had babies also. Yes, Babs.
I also wanted to pick up on something Trace said, which was the feeling of finally getting heard. And, you know, I went over a year with my back pain, not being allowed to have anything more powerful than paracetamol, to the point that I was maxing out on how much paracetamol you could have in a day. And it just wasn't enough to deal with my back pain. And it was over a year from the date of the time I had the accident to when I finally even got the results from the MRI. And the doctor that I had by this point seen a different doctor. And the absolute relief in myself when he was going through what they found on the scan, and the fact that he's like, right, we really need to be putting you on, you know, cocodamol, and we need to put you on naproxen, and this is what we need to do to help, and if that doesn't work, we'll try something else. It took over a year, near enough 2, to get to the point where I was actually being treated for the pain properly. That was nearly 2 years of being scared to just walk to the doctors because I had to keep stopping. Like, I literally lived on the same street where my doctor's surgery was. So if my appointment was, say, at 2, I was leaving the house at 1 o'clock, because the amount of how much I could walk before stopping, it could take me up to an hour to walk up the street. And it is so hard when you are being gaslit and when you're being ignored, or it's being pushed onto your weight, or it's being pushed onto the fact that it's a, quote, natural woman thing, or whatever it is. So it is devastating because, you know, honestly, if I had maybe known about what was going on with my spine, maybe even a year earlier, maybe I could have stopped it getting as bad as it has got. Maybe I could have put it in its tracks. Maybe I could have done something else. And maybe that would have meant that I'm not sitting here at 38, a parent without a child. You know, there's a lot of regret. And I don't wish that on anyone.
No, absolutely, Babs, and I absolutely agree with everything you've just said there, and I'm so sorry you've been through all that. I mean, it's hard enough being a woman without having to deal with everything else on top of that. Yes, Trace?
Well, the only thing I can say is Babs, I do understand the medical history of everything. because starting at a young age and between cysts and tumors and miscarriages, losing a baby with my twins, I can understand where you're at. And the blessing about it is that we as women are emotional and our foundation is nurturing. And when we feel that we are out of place or not in the right frame of mind between what we're talking about here today, the NHS, or here in the States with doctors, we have been pushed into a box that basically puts us as dismissing us, or, oh, it's no big deal, or, you know, you've dealt with it. And the stronger that you are, somebody will put you back into your place.
Mm-hmm.
So for all of you women listening, do not let someone put you back into your place. You know intuitively something is wrong. So keep fighting and keep being patient with yourself. And every day something will be placed in front of you that might block you from continuing to move on, but continue to move on because there is a reason behind where you're going to end up. And if we supported each other more in that venture, that might help us in those kind of troubled times.
100%, Trace. I agree with everything you just said. So I'm just gonna say this one last thing, and then we're gonna end this episode. I just want to point out how much it is bad for women in the NHS or at the doctor's office. I have 2 cousins. Okay, they're a brother and a sister, and they go through the exact same. They have the exact same condition. It's a nervous system condition. It's really severe, and she's got a lot of nerve damage because of it, right? Both of them have gone to separate doctors. They've got like different doctor practices, separate hospital appointments. He has had no problems at all. He has had really nice doctors. He's been diagnosed well. He's got his medication, no bother. They're trying to help him manage everything. She has been gaslit, diagnosed, misdiagnosed, the diagnosis taken off her, then re-diagnosed again. She's literally going to have to leave her doctors to try and go to another doctor's to see if this doctor's will actually listen to her. She's been at the hospital, spoke to a doctor about this condition who screamed in her face and left her in tears. Like, I mean, absolute tears that she did not have the condition she knows fine well she has because it's hereditary. It's a very, very rare condition. There's only a few people in the world that have it. Well, in Scotland, sorry, that have it. And her and her brother are one of those people. But because she's female and he's male, this is why they've been treated differently. Well, here, anyway. So before we get everyone's final thoughts, can I just remind everybody, please, to feel free to comment and share your own story in the comments. I mean, as you can hear today, every single one of us know exactly what it's like and how hard it is to be a woman in today's world. So, girls, any final thoughts, Ryan?
Well, you know, sitting here thinking, I'm going to quote, you know, the Golden Girls because it's the Golden Girls.
Well, of course.
When Dorothy said to the doctor that was gaslighting her, I hope one day you get sick enough and scared enough, but still get better care that you have given to me. All of these doctors need to pay attention to their patients because it is not only your name on the line and your reputation on the line, it is their life on the line. You're not just going to ruin their life or take their life away. You're going to ruin for the family because you were inept to take care of their family member. And it's not right. This is why you went to school. You wanted to help people. So help them.
I just wanted to say that it is a pleasure and a treat to be on a panel with all of you women. And for the women that are listening, build yourself a nice support system and a support group, because you will need it. And only keep that support group to the ones that will support you and help you through things, not criticize you. So again, being out in the world of medical field is, I know, trial and error, and you will get someone who won't listen but keep pushing through.
Just want to say, if you feel like you're not being listened to by your doctor, or you don't feel like you can come forward and tell the doctor what you think is going on, take someone with you that you trust, or write notes before you go of questions you might want to ask, just so that you've got somebody there or them notes just to help you.
So what I would say to every woman out there is the NHS website, if you can't afford private, the NHS website is your friend. It will tell you things that either you may not know about, or that you are not aware, you may not know about, or you partially know about. I would also urge you to look into your GP practice's complaint procedures, and if you do get gaslit, or you do feel like you've been dismissed, or you do feel like a doctor or a healthcare professional has said something that is off, complain, because you deserve to be treated with dignity and respect. And finally, in the UK, I don't know about the US, if you feel that there is something that you've seen on the NHS website that you're eligible for, that you meet the criteria for, but your doctors are saying no, contact your local integrated care board. There is a different one for every area, and ask them what is their funding for, because whilst not everything is funded on the NHS as a bog standard treatment, for certain medical necessities, for instance, breast reduction for health reasons, a lot of integrated care boards can apply for funding to cover the cost, as long as it is not cosmetic for the sake of cosmetic. And contact your integrated care board, get a list of their procedures that they do cover, that will cover tests as well, and arm yourself when you go back to your GP and say, right, I know you've been talking shit, and here's how I know. Because knowledge is power, and knowledge is the only thing we have to defend against the gaslighting bullshit.
Yeah, definitely for me, everything everyone said, absolutely. And you know, they always ask this ideology, what is a woman? Listen to everybody's story, and that's what a woman is right there. The pain we go through for childbirth, you know, the emotional, like, ups and downs everything has, like, they've no clue. Yeah.
So I just want to thank everybody, every single one of you amazing women that joined us today. Every single one of you are warriors, in my opinion. Everything that you've been through, overcome, has just been absolutely amazing. And for any women out there watching this today, like, just remember you have a voice. Yeah. And you can use it, and you can be loud. Like, I suggest you be loud, and don't take no for an answer. Like, honestly, because in today's world, if you don't get loud, nobody seems to actually want to listen. So, just a little reminder for everybody. Next week, myself, my wife, and Bubs will be back here for the very last episode on the NHS. Mm-hmm. And we will be joined back here by our other counterparts, Storm and Scorpio. So I just wanted to say thank you so much to everybody on the panel and to everybody watching out there today. And we will see you next week. Bye.
Thank you for watching our video on women's health. Through the Rabbit Hole is a channel by the people for the people, committed to giving you the truth through real, unfiltered discussions. Follow us on Facebook and TikTok for updates on new videos and information. And make sure to subscribe here on YouTube to stay connected with us. We want to hear from you. Drop a comment below or leave a message on our community tab. Let your voice be heard because your voice matters to us.